Hi everyone, my name is Ana Julia and I'm here for my co-authors, Lucas Bragança, Francis Sodré, and Fabio Malini. We are all from the Federal University of Espírito Santo, Brazil, and our paper is titled Digital Activism and Empowerment in the Promotion of Public Health, the Role of Social Media and a Vaccine Mobilization in Brazil. This research is part of a larger monitoring effort called DNA Project, Monitoring Activism Narratives in Brazil, which is run by the LABIC at UFES, and our main goal is to analyze how different narratives circulate and impact public policy in Brazil. So, this study set against the background of the health communication crisis in Brazil, where the COVID-19 pandemic exposed social problems and caused a crisis of trust. This environment was made worse by the infodemic, which is an overload of misinformation. And our study's objective is to analyze the narrative strategies of this activism in pro-vaccination campaigns or Instagram and Facebook in 2021. Our methodology uses a mixed method. We combine network analysis with qualitative reading of the message, and the data come from DNA projects and covers 2021, a critical year for immunization. And we focus on a large sample of posts from Instagram and Facebook that included specific privacy hashtags like vacinasim. Our analysis was done in two steps. First, thematic content analysis following Burton's method to find the main categories of messages like effective language and solidarity appeals. Second, social network analysis, SNA, using GFE software to map the networks and find the most central hashtags and profiles and identify the cohesive groups or clusters. This mixed approach gives our analysis strength to compare the symbolic structures of both platforms, Facebook and Instagram. Let's look at the first key finding, the Instagram network showing figure 1, and the main point is cohesion. The network is very dense and connected, meaning the public movement was unified and strong. The discussion had two main ideas. First, the effective and civic core, with central hashtags like vacinasim and Viva o SUS. These words linking vaccination to important values like solidarity and collective care. And second, there is a clear political axis likened to nodes like Fora Bolsonaro. The network worked because it changed medical information in a powerful shared emotional value. Now, let's compare this with the Facebook network, shown in figure 4. This place was much more tense and broke up the keyword dispute. The public had many different clashing opinions. We saw campaign words next to confuse or political words like hashtag vacinação obrigatória and direito escolha. The clear politicized axis with terms like hashtag Fora Bolsonaro confirms that political facts strongly affected the vaccine talk. Also, the people with the most engagement were in small, specifically ideological groups. The groups were not well connected, which means information stayed more in echo chambers. This made it hard to get a unified message across to everyone. So, about the discussion, the good potential and the hard limits of digital activism. The study confirms the potential for people to organize themselves in the power of emotion and social movements. Authority now comes from people who have cultural and emotional trust, not just from official offices. Whatever, there are two main structural limits. First, a lack of coordination. Actors are often spontaneous and not planned with public policy. This makes the effort stop after the crisis. Second, algorithmic bias. Social media rules of favor sensational or political facts. This can hide the good, evidence-based message. We conclude the government communication only works if it joins local, trusted voices. To conclude, research gives important ideas for future public health communication. The effective score is clear. Success came from using emotion and make technical knowledge simple through people work together. This leads to a new paradigm, future strategies, more including listening to people. So, letting people help you read the message. Respect cultural difference. We propose a mandate for policy. Public health communication must be a structural and permanent part of public policy. This needs long-term, money, specialized teams. Our final goals is used to knowledge to strengthen communication and build a plural and democratic collective health project for Brazil. Thanks for your attention.